Hello, I'm Dr. David McFadden at the Dental Implant Center here in Dallas, Texas. Today I want to ask you a few questions about looking at dental galleries and watching commercials on television. I don't think you'd be watching this video unless you are looking for dental treatment, and you've probably viewed some galleries, and I know you've seen those hundreds of commercials on TV for corporate dental implant centers. So I want to talk to you, I want to educate you a little bit about dental photography. Most of us that do reconstructive dentistry take a lot of pictures, and many of the galleries you've seen will not show you lips retracted treatment. Why? Because they don't want you to see how the prosthesis meets the gum line, if it meets the gum line at all. And speaking of those commercials on television, if you go to the website, go to their gallery, you will not see one lips retracted picture. And why is that? They don't want you to see what the prosthesis looks like at the gum level. If it's not fraud, it's certainly dishonesty by omission. So you'll see that I've probably got 100 cases on my website gallery, dentalimplantcenter.com, and under the gallery section, at least 100 cases. Every single case has lips retracted before, during, and after treatment. I want you to have a much better visual picture or a better understanding about how the prosthesis meets the gums, because that's what really makes or breaks the case. How well you can clean it really depends on that interface. So I know I've said this many times in my other videos, but a foundation on a house. If the house is built before you see it, it may look like a great house, may be perfect in every way, but you have no idea what that foundation structurally is like. So in dental implant treatment, it's exactly the same. The foundation sets the tone for the prosthesis. And if the foundation's wrong, the prosthesis is never going to be right. You're always going to have trouble cleaning it. You're going to have trouble speaking because of that interface between prosthesis and tissue. So like this gentleman behind me on the screen, and we'll show you these pictures as an outtake, but the smile looks great, right? I think we'd all agree his smile looks great, but you peel back the curtain and you don't always get to, that's the only way you're going to get the real picture. So imagine a smile that looks like this, and then the lips retracted and it looks like this. It's important that the consumer sees this. Again, doctors should have nothing to hide, but without doing lips retracted photography, you can be very easily misled in thinking that a beautiful smile is easy for us, and it is not. Full mouth or full arch implant reconstructions are the hardest thing in dentistry, and everybody in dentistry would agree on that. It's tens of thousands of dollars, and you want to get it right the first time. So let's go through these three cases that I mentioned. We'll start with this next picture. So this is a gentleman I've shown you before in one of my other videos, and he has a pretty nice smile, right? I mean, anybody looking at this gentleman in public or even on a blown up picture like this would agree that the smile is pretty nice. But we go to the next picture, and it is a toxic train wreck. The interface between the prosthesis and the gums. It's actually prevented by poor implant placement. And I've talked about that in a dozen videos at least, so I won't go into that today. But this is not at all unusual for full mouth implant treatment to turn out like this. But watch the commercials and go to the website. All you're going to see is picture number one. This is the other gentleman that I started the lecture with. And as you can see, beautiful smile. Peel back the curtain, and that's what you see. Sloppy implant surgery, exposed implants, exposed abutments, uncleansable prosthesis, and air now flows between the gums and the upper prosthesis, negatively impacting his speech. But his smile was great, right? And that's all you get to see in most websites. So what do we do here? This is one of my cases. I don't think it's in the gallery yet, but it will be soon. I'll call it a coming soon trailer. But this woman came in with failing dentition. So we start out with a series of pictures that shows her current situation. These are the before pictures with lips retracted. That is her final outcome, lips retracted. So you can see that these teeth interface with the gums just like natural teeth. So it's a normal cleaning protocol with brushing, flossing, and water picking. Probably takes her 5 minutes per night to go through that ritual. But again, if I only showed you her smile as my final outcome, you would never know what it looks like underneath. So I guess more than anything, this is another one of my famous buyer beware videos, and I wanted to make sure that you understood how important, when you do your research about finding the doctor that's going to fix your mouth for tens of thousands of dollars, make sure you've seen the work with lips retracted. Thank you.